Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. As you can see in this pseudo panoramic view, that we've got the upper area of interest and we've got basal implants placed, which are three on the top right and no implants on the top left. Starting with the posterior right segment on the transaxial view, you will be able to appreciate that there is absolutely no bone in this region for an implant placement. Moving to the distal most implant, this also has significant bone loss around it. And even if this is extracted, there is no limited bone for implant placement. This is the region of the five. Again, no bone can be seen here. Absolutely weak bone. It's very paper thin. Moving to the implant in the middle, it's also fractured with very limited bone available here. If this is extracted, then you will only be left with 5 millimeters of ridge width with only 5 millimeters of height. The implant, which is the mesial most implant, is also extracted with parts of it present in the sinus cavity. We only have 4 millimeters of ridge width with only 5 millimeters of height. In the anterior region, again, very limited bone, not sufficient for implant placement. As we move towards the top right segment, again, in the anterior segment, we have the incisive canal and absolutely no bone for implant placement. As we move towards the posterior segment, unfortunately, there's no bone in this entire region where we can even think of placing a virtual implant. Thank you very much.